In 2020, 1,300 German ophthalmologists were polled about the current state of glaucoma treatment in Germany. When it comes to topical therapy, about 2/3 of those surveyed found that eye drop side effects had a significant negative impact on their patients' quality of life. Common complaints include redness, burning, increased eyelash growth, tearing, and the sensation of a foreign object in the eye. Compliance was also an overarching concern, as the average rate of non-adherence to regular eye drop regimens was 32%. These challenges with topical medications have prompted a shift in glaucoma treatment, with increased interest in surgical solutions.
Historically, the majority still treats patients for decades with local medication and take all the problems the patients have in account. And the trend towards surgery has shifted a lot since the introduction of the mixed procedures. I think the point to treat a patient surgically should be rather early in order to turn around the course of the disease early enough, also to save him all the side effect trouble.
Aiming to evaluate the long-term impact of ab-internal canaloplasty, Dr. Norber Koerber and Dr. Zeman Andrejka conducted a retrospective single-center case series following an IOP and medication burden reduction. The study took 27 eyes at baseline and then followed up every year, finishing at 6 years. A total of 18 eyes with a mean age of 76.9 remained after these 6 years, making this the most long-term ab-internal canaloplasty follow-up study available in the literature.
The reason why we did this study is to see if the pressure reduction, the IOP reduction is constant, and also if the reduction of medication is permanent. A major part of this initial group of patients was suffering from severe side effects, not having a bad IOP regulation, but real problems with the side effects. So there was a double issue. One issue was to bring the IOP down, and the second issue was to reduce the medication burden.
The results were clear in the context of quality of life and freedom from the burden of a drop regime. Mean IOP saw a meaningful reduction from 19.9 millimeters of mercury at baseline, with no washout, to 14.6 millimeters of mercury at the 6-year follow-up, a 27% drop. Critically, the number of eye drops in these patients also reduced from 1.9 at baseline to 0.9 at 6 years, a significant 52% cut in medications.
In terms of quality of life, is for the patient subjectively is the reduction of the medication. And we can see in this follow-up of 6 years that during the first 2-3 years, the number is really very low medication. After 4 or 5 years, of course, this can be expected in every glaucoma procedure, the medication rate goes up, but still there is a nice number without medication, and the overall medication is about half of the medication 6 years before. So I think this is a big advantage for the patients. The second advantage, of course, is that we have a stable IOP reduction over this time. It's not creeping up, it's stable. And that's very interesting and also very important, of course.
Though 18 eyes ultimately went the complete 6-year distance, they showed consistent reductions in both IOP and medication use. IOP remained stable in 2 eyes, while it showed a decrease in 16 eyes, or 89% of the total. No eye showed an IOP increase. The story was similar with medications. 11 eyes, 61%, of all 6-year follow-up eyes required fewer medications, while 4 eyes, 22%, maintained the same medication regimen. Only 3 eyes, 17%, required more medications than at baseline. Also, no patients were medication-free at baseline. But after 6 years, 7 of 18 eyes were medication-free, an encouraging 39%.
I think it's a combination of the improvement of the outflow system and also, of course, of the micro-ruptures which we cause in the trabecular meshwork, and the complete dilation of the canal also facilitates that, but there is no real clue which part of this is now responsible. But it must be some sort of combination of this. The selection is if the major group is patients having a glaucoma, being under treatment and requiring a cataract operation. And then if they have more than one medication, I always recommend to do the ab-internal procedure. This is a good chance for the patient to get rid of the medication and to get a better IOP reduction than with the cataract operation alone. The only risk we take is more or less that it doesn't work. which is not so frequent. I mean, we have a success rate of nearly 90%. Most of the patients are really happy that they get an offer. Some of them really report that they feel overall better. Most patients anyway are happy because they get the cataract done. And then they realize after 4 weeks when we stop the medication for cataract, they don't have to use any other medication again. And so that's something they talk about. But if I get feedbacks, let's say, to say thank you, it's most times about quality of life and not about anything else. They just write all my troubles are gone and I'm grateful. This is what I get as a feedback usually.
With this new data on ab-internal canaloplasty, ophthalmologists now have a long-term option to improve patient quality of life so that patients can lead fuller, richer, and more independent lives, free of fear about their glaucoma.